I'm going to show you how to complete your Purpose T assessment and skin care pathway on admission. So our patient has been admitted and now shows in on our bed board in Care Compass. So we are going to then pick up our assessment tasks. So clicking on the assessment arrow in the patient name box, we are going to look through, and as you can see, the normal admission assessments and tasks are here. So we're going to navigate to the bottom. As you can see, we now have a new Purpose T assessment, and it instructs us to open the patient record and click Care Pathways. So we are going to close this view and click on the patient name to enter the patient record. Now on the blue menu, you can see a new component, which is the Care Pathways component. And this is the Care Pathways landing page. Now within this page, you can see several areas. So you've got suggested care pathways, active pathways, historical pathways, and available pathways. So suggested pathways are ones that are suggested on admission, and they are mandatory for patient care. We have active pathways, so if this patient had been in for a number of days and we'd already documented in a pathway, they would show here. Any historical pathways that have taken part in different admissions will show in the historical pathways, and also pathways that are dependent on the patient's condition rather than being mandatory can be found here. And the first one that you will see live in the patient's record will be Care of the Dying Adult, which is coming soon. But for now, we're going to start the skin assessment and pressure ulcer prevention care pathway. I will do that by clicking on Start. So as you can see now, it's opened a page which looks very similar to your workflow end pages that are in your nurse view. For example, your nursing handover page or your manage page. So we're going to go through the page at the moment. So as you can see, the top component is the screening tool, which we'll come back to in a minute. And then we have the forms and links page. So this contains a useful link. So it takes you to the Tissue Viability Service workspace in SASHNet, which will give you clinical guidance of how to complete the assessments, and also the digital support portal, which will give you access to the quick reference guides and videos to help you with the digital navigation of the record. And over to the right, you've got your skin and pressure forms. So these are power forms that are just pertaining to skin. So from now on, when this care pathway goes live, your skin and pressure checks and repositioning checks will all be carried out in a power form rather than within the blue menu in assessments and fluid balance. We've also popped in the chaperone form in here just in case you do feel you need to use this. Going back through the components, you can have the Purpose T and risk assessment. So as when we've completed the Purpose T, this will show in this box. And then the daily assessments will show both the skin checks and the positioning checks as we complete them. Underneath that, we've got wound-related microbiology, and here you'll find not the entire lot of results that you see in results review, but just the ones pertaining to skin, such as wound swabs. Underneath this, we've got a documentation or documents component, but this will only contain documents relating to skin, for example, tissue viability notes and body maps. Underneath this, we've got a care teams. Now, our care teams are used by roaming teams such as our TVN team or our outreach team, or for example, our acute pain team. And these are teams that have patients dotted around all over our hospital, and the care team is their version of a patient list. Now, this may give you an indicator whether a certain care team has got your patient under their care, and will give you a view if you've referred to a certain team, you can see whether they've accepted it by looking at the care team. However, just be aware that they may not have seen your referral yet, and they may have rejected it, which will show in a different area. And then we've got the usual request prescribe component, which is very similar and exactly the same as the request prescribe in the blue menu and in the pages within your nurse's view. But for now, we're going to go back up to the screening tool, and we're going to complete the first step of the Purpose T, which is the screening questions. So the first question we've got is our mobility status. So you can see the options here: the walks independently, needs help of another person, spends all of the majority of time in a bed or chair, and remains in the same position for long periods. Now, we may have a patient that has one or two of these. So for example, walks independently, however, spends the majority of time in a chair. And we would always pick the option of the highest risk to the patient. So in that instance that I've just mentioned, you would pick spends all of the majority of the time in the patient's bed or chair. But for our patient that we are assessing now, we are going to click walks independently. And then we have the skin status question. And these go from normal skin to vulnerable skin, a history of a previous pressure ulcer, if they have a medical device that could cause pressure or shear at the skin site, or a current pressure ulcer category 1 or above. And again, you may have a patient with both normal skin and a vulnerable skin or history of a previous pressure ulcer, and you would go for the highest risk of this patient. So if I had a patient with normal skin but a previous history of a pressure ulcer, I would pick and document the answer to be the reported history of a previous pressure ulcer. But our patient now is going to be abnormal skin, so I'm going to click within that section. And then it comes to the last question of the step 1 screening, which is the clinical judgment. And this is where you take into account things like medications the patient might be on, any conditions or treatments which could significantly impact the patient's pressure ulcer or significantly impact the patient's skin. For example, diabetes, if they've got poor perfusion, if they've had previous comorbidities, you'd pick the top box. But now we're going to click on no problem. So we've now completed the screening and we're now on to step 2, the assessment tool. And for step 2A, it's saying click here to document the skin check. So I'm going to click exactly on the blue link there, and this will open the skin check. Now, this skin check is the same skin check that can be done within the task. Once we've completed the power plan, it will task you a certain skin check to be done in a certain period of time. But this also can be done in a PRN task. For example, if you have just taken a patient to the toilet or washed the patient and you want to do an ad hoc skin check, you can document within the same form. So we're going to go through the skin check now. So the first question is, has the patient declined a skin check? So if they've got a patient that doesn't want you to look at their skin, we can click on yes for this, and it will let you document the reasons why the patient's declined, what actions you have taken. For example, have you talked to the nurse in charge? Have you discussed the risk with the patient? If it's applicable, have you discussed the risk with the patient's next of kin? And if you consider a capacity assessment, you can document within this page all the actions you've taken due to this. However, if you've got a patient like yourself that may have just walked into ED or is normally fit and well, and they are capable of self-reporting that they have got normal skin, you can click on that option and then you can document this patient has self-reported normal skin by clicking on the top box. But our patient at the moment is not declined a skin check, so we're quite happy to have a skin check. And this will take you to a page with a full skin check on it. So here's where you can document pain, you can document normal skin, vulnerable skin, category 1 to 4 pressure ulcers, a deep tissue injury, and you can also document if a patient's declined certain areas. And to the right as well, you've got some guidance, several sentences within each category that can help you decide what to document for your patient. But our patient has got normal skin, so you can actually click in the normal skin box to document in all areas. But if you wanted to document some vulnerable skin or higher risk of skin damage, you can actually click in each box as needed. But we're going to go back because our patient has got normal skin, so we're going to click in the top box. We've also, this is where you'd also document if the patient's got any moisture associated skin damage, and for our patient we has none, so I'm going to click into that box. And also, if the patient has got pressure damage, we would like you to take a photograph and so it's available within the patient's EPR. However, our patient hasn't got any skin damage, so at the moment it's non-applicable. So then we're going to tick on the top swirly arrow to return to the next page. And then we've got the medical device check question. Now there's lots of medical devices in this component here, and the list is not exhaustible. So if you can't find your medical device that you have checked, you can click on other and type it in there. But for now, our patient has no medical devices, so we're going to click on non-applicable. So that would be the skin check done, which is needed as part of this assessment though if you want to go further and you want to document patient position or equipment, you can do this by clicking in the components to the left-hand side. And this is where you can document where your patient is now, what your patient's position was before repositioning, and what's the patient's positions changed to. You can also document if there's any pressure relieving equipment currently in place. And also the LESS component gives you some guidance on skin areas and also the SASH pressure ulcer categorization guidance. But we're going to go back to our skin assessment and we're happy that we've filled everything in. So we're going to click on the green tick to the left-hand side. Okay, so now we've completed that skin check, we're going to go down to step 2B, which says only click here when you've completed and signed the form above. So I'm going to click in that box. And now it's used the documentation that we have entered into the system, and it's suggesting in step 3A that this patient has no pressure ulcer and is not currently at risk, and it is suggesting a green power plan. Now that matches what we've documented within the system, so we are going to go to the next step, which says go to step 3B, treatment options, which is up to the right of the screen to order the power plan. So under treatment options, you can see the power plan and you can see that signified by a little icon that looks a bit like a pizza slice. So we click in that box, we go up to our basket to the right hand side, click in it, and then click sign. And this will open the green power plan. So as you can see, there's different options within this. They're all pre-ticked, so you haven't got to do anything. But let's read through it now. So you can see that this has been documented as a assessment decision green, no pressure ulcer, no, not currently at risk. And it's suggesting a skin check on reposition of patient every 12 hours. Now this is the minimum for all our inpatients, which is once a shift. So I'm happy with that. So I'm going to click on orders for signature. And then we see the summary of what the tasks are. We're going to click on sign. And now we're still going to follow the instructions of the care pathway. So once it says order the power plan below, then return to the screening and assessment tool. So we're going to go to the screening and assessment tool and go down to the last option. And it says once the power plan has been ordered, click here to continue. So we're going to click in the box. And here is when we document whether we've agreed the plan of care with the patient. So the patient knows that we're going to do skin checks every 12 hours, and we have documented that they're not currently at risk of a pressure ulcer, but we will be reassessing them on a weekly basis. So if you click on no, that the patient doesn't agree, it's the same questions that you would see in the skin check. So you get a capacity, whether it's no matter what you sign here, comes with the same next questions. And again, you can document your actions taken, whether you've informed the nurse in charge. Again, discuss the associated risks with the patient, discuss if applicable with the next of kin, and consider the capacity assessment. And you can document any other actions taken at the bottom there. But for our patient is very happy with their plan of care, so we're going to click on yes. And then to end the care pathway, we're going to click on save. Now, as we scroll down the form now to look at purpose T and risk assessments, if we refresh that area, you can see it gives us a summary of what we've documented, assessed and ordered. So we are on a green power plan. We are going to look at our skin check every 12 hours. It gives a summary of the screening that we've completed. Okay, and we've agreed a plan of care with the patient. Then if we go down to daily assessments and we refresh there, you can see the assessments are now captured in that area within the patient record. So again, we no longer go to assessments or fluid balance to see completed assessments. We go within the care pathway and in daily assessments there. Now, within a few hours' time, your care compass will show a task showing that a 12-hourly skin check is needed, and you can see it in there. But also, if you go back into the same patient's activity view and in PRN, you can also see the ad hoc skin pressure check that I mentioned before that you can click on document, and you can document a skin, a pressure or a repositioning check anytime you wish. But if we go back into the patient record now and click and refresh and reopen the care pathways, we are now going to reassess the patient. So we would reassess the patient and do another purpose T assessment weekly, or if a condition deteriorates significantly. So we are going to open the same care pathway now, and our patient has deteriorated. They've had a CVA whilst on the ward, so we are going to reassess this patient because we feel that we're at greater risk of pressure damage and risk to their skin. So we're going to click on reassess to screening. And for now, we're going to tick on spends all or the majority of time in a bed or a chair. Now, as you can see, that stops the screening questions and goes on straight onto the full assessment because the system has noticed that the patient is at greater risk now. So we're going to follow the steps again. So we go down to 2A and it says click here to document the purpose T, step 2 full assessment form. And we need to click exactly on that blue link. As you can see, if you put your cursor over it, it's got a blue line that appears underneath it. So we're going to click within that to open the full assessment. Now, this full assessment is quite busy and it mimics the paper purpose T form that you can also complete in the downtime. And we suggest that you go from left to right, then down, and then left to right again. But let's go through these boxes now. So the analysis of independent movement goes from doesn't change position at all to moves occasionally and frequently and has slight or major position changes. And we have assessed our patient that moves occasionally and has slight position changes. For nutrition, this is a different type of box. It's tick all applicable. And so it means that you can tick as many or as little options as needed. So if you've got a patient that's had unplanned weight loss and also poor nutritional intake and also a low BMI, you can tick all three. But at the moment, our patient's got poor nutritional intake. And then we go on to the must overall risk. Now, before you do the purpose T assessment or the skin pathway as a whole, we suggest you either do your must assessment or complete the nutrition care pathway. And this will pull in all information that's pertinent to the must score within this. But we're going to go on to the diabetes section now, and we're going to click on non-diabetic. And then we're going to go to perfusion. And again, it's tick all that's applicable because with this patient might have conditions affecting both central and peripheral circulation. But our patient at the moment has no problem, so we're going to tick in that field. And then we're going to go on to medical devices. And this is, again, this is not an exhaustive list. You've got to think about if medical devices could be causing a heightened pressure risk or skin damage to your patient. Now, our patient had TED stockings on that haven't been removed for 2 days. So I'm going to click on yes. Our patient has got a medical device that could be causing pressure or shear. And then we're going to go down to the moisture due to perspiration, urine, feces, or exudate. So we're going to tick on frequent 2 to 4 times a day. And then we're going to move across to our sensory perception and response. So as I mentioned before, our patient has deteriorated, they've had a CVA, and now is unable to feel or appropriately respond to discomfort from pressure. So I'm going to click on the second option. And then we go down to previous pressure ulcer history. Now, this is something that's quite unique within Purpose T, and it's not something that we've seen within Braden or in a pressure risk score before. So if I was to click on pressure ulcer history, if a patient has got the history, it will open up several new boxes. And this is where you can document the number of previous pressure ulcers, the worst recorded pressure ulcer, the worst recorded site, and an approximate date. Now you see a lot of these are free text boxes because our patients might not know exactly when they had a last pressure ulcer and what the site was and what the category was of that ulcer. And here's where we'd suggest that actually you'd look in places like the Surrey Care Record, if a patient is a Surrey patient, or you look in the patient's paper notes, or in other areas of the electronic patient record, look for evidence to have this. But as I say, you might have to put unknown in this, and that is absolutely fine. Just put as much as information as you possibly can. However, this patient hasn't got any pressure ulcer history, so we're going to click on no known history. And then we've got the same declined skin check questions as we had throughout this presentation. And exactly the same, does the patient have capacity? The reason why the skin check has declined, any actions taken. But we're going to tick that patient has not declined our skin check And we're going to go back down to our skin check here. And it's exactly the same as the skin check in the other form. So we are now this time going to assess our patient, and we have assessed our patient that they've got pain in their sacrum. They have got most areas normal skin, but we've noticed that they've got vulnerable skin to their left heel, and they've got a category 1 pressure ulcer to their sacrum. So we are going to document as such. We also then are going to recheck to make sure we're happy everything's in the right fields there. And then we're going to go down. And if the patient has got moisture associated skin damage, we can document it here in the correct area with an option to click on other if it's an area that we have not, you can't see in this box. But at the moment, we're going to click on none. So now I'm happy that I have completed my Purpose T full assessment, and I'm going to click on the green tick at the top corner. So now we've gone back to the screening tool and we're going to follow the next step. So step 2B says only click here when you've completed and signed the form above, which we have. So we're going to click in the box. And now again, the system has taken all the information that we've documented. And as you can see, the assessment decision is a pressure ulcer category 1 or above, or scarring from a previous pressure ulcer, which is a red power plan, which agrees with the documentation that we've actually assessed and popped into the system. So we're happy with that. So we're going to go on to the next step. And again, we'll go to the right of the screen to the treatment options to order our red power plan. So we will click again in the box with the pizza icon, and then we go up to our basket to the right hand side, click on sign, and then we'll open our red pathway. So in this pathway, it's obviously a lot more involved than the green one that we saw earlier on. So as you can see, this patient has a red assessment decision, which is a pressure ulcer category 1 or above, or scarring from a previous ulcer. We can see that the skin check is going to order a skin check task, which is for every 2 hours. However, you can use this downward arrow to change it to every 1 hour if appropriate. But just for a nice safety check in here as well, you can always increase the frequency of the checks, but you can't decrease. You can't make them less often. It's going to add a diagnosis of a pressure ulcer in this record, and then it also gives you a bit of reference text that because this patient's now got pressure damage, that you've got to gain consent to take photos to be put in the patient record, and also because this patient has developed their pressure ulcer within the hospital stay, they've got to complete an in-phase report. It will also task a PRN incision wound skin assessment, so you can document what this area of skin damage looks like. It will also task you a review of healing for 4 weeks' time. Now, this can be done for the TVN if that's appropriate and they're looking after this patient, or your nurse in charge, or your greater MDT team. And this will be in 4 weeks' time if a patient is still with you at that point. And as you can see, the boxes that we've just been through are pre-ticked. And then we're going to go on to the referrals. So you've got 2 referrals within this. You've got a referral to the Tissue Viability Service, and you've got some indications for a referral below. So this can be pressure ulcer category 3 or above, or advice on wound management. But our patient, we've documented that they've got a category 1 pressure ulcer, so I would not refer to the Tissue Viability Service at this point. However, we've got referral to dietitian at the bottom, and under the indications for referral, we've got a pressure ulcer category 1 with poor appetite, which matches what we've documented in the full assessment. So we would refer to the dietitian in this instance by ticking in the box here. And then once we are happy with the referrals, if we're going to make the referrals and we're happy that we've got the information above, we'll click on Order for Signature and then sign the summary of the tasks. And as you can see, there's a pop-up here that's giving you a little bit of a warning for the updated frequency. So as you know, for this patient, we've gone from a green power plan to a red power plan, which means we've gone from skin checks every 12 hours to every 2 hours. Now, this just gives you a reminder that actually you may be working with other members of the team, for example, another nurse or a nursing assistant, and just to remind them that actually the tasks have gone from every 12 hours to look for them every 2 hours, so that everybody in your team is on the same page and understands that this patient has heightened pressure and skin risk. So we're going to click on OK, and this will take us back to our care pathway. So we've ordered the power plan, and then we've got to return again to the left-hand side of the screen and go to the bottom step, which says once the power plan has been ordered, click here to continue. So we're going to click in the box. And again, we've got the same questions about the plan of care agreed with the patient. And this is really pertinent in this case as well, because this patient is now under a red power plan. So we'll be checking their skin every 2 hours. We'll be repositioning them every 2 hours. So we want to make sure that the patient is fully aware of that. And our patient today is happy with that. So we're going to click on yes. And we're going to click save to finish the care pathway and the purpose T assessment. So that has been completed now. So if we go back down this page now, we have got the purpose T. If we refresh, we can see within this that we've got a summary of the documentation. We are going to do a skin check every 2 hours. This patient's on a red power plan, and they've got a pressure ulcer of category 1 or above. And if we go down to the daily assessments again and click on the refresh button again, we can see that on our most recent skin check, it is documented they've got a pressure 1 category ulcer on the sacrum, and they've got vulnerable skin on their left heel. And it's really nice that actually you can see these areas of vulnerable skin and pressure damage in red. So you can really, really see them within that skin check, and it hones you into the skin damage to keep an eye on it. So now we're going to go back up to Care Compass to look for the tasks. Click on the refresh button and go back into the patient's activity view. And if we click on the next 4 hours, at the bottom, you can see that in 2 hours' time, we've got a skin pressure check ready there, ready to complete. But if we go into the PRN continuous, there we can find again the ad hoc skin pressure check and the repositioning check is always there. But now we've got an incision wound and skin assessment. And here's where we would document what our area of pressure damage looks like. So we would highlight the task, click on document, which will take us into an area into assessment and fluid balance. And we are going to document this area of damage. So we're going to click on this icon here, which is called a repeatable group icon, and this creates a title for the area of damage. So we have a pressure ulcer, and our pressure ulcer is on the sacrum. So we're going to click on OK, and then we're going to document more information about it. So we document it again, it's a pressure ulcer. Now we've got to do this again. I know we've just done this, but this is to document the documentation, whereas before it was to document the title of the group. It's a category 1 pressure ulcer, and this patient is not being cared for in the community with this area of skin damage. It's an acute, less than 30 days, and we've done it in phase, and we're going to put the in phase number in here as needed. And then we're going to document the wound activity. And within the wound activity, this is where we document the wound evaluation, if we've done any dressing changes or removed a dressing, and we've done further on higher cases. For example, if we've got a vac dressing on, or we've done a wound closure or debridement, you can document that in here as well. But for now, because we're documenting the evaluation of this patient, we'd click on the evaluation area. And this will open where you can document the wound length, width, depth, the edges, the colour, the surrounding skin around the wound, if they've got any exudate present, etc. And you can fill in all this page and then click on the green tick. But we're just going to click on the length, which is in centimetres at the moment. But just check to make sure this is in centimetres or millimetres and change it as needed. And then 3 for the width, and for the depth, we're going to click on 1, 0.1. Okay, so we've got that information there at the moment. Of course, you would also fill in an all here if you were doing this for a real patient. We'll click on the green tick, and I'm now going to show you where you can find this within your care pathway. So we go back into care pathway and we're going to refresh the page. And as you can see, we're entering back into the skincare pathway. And then we've got treatment lines at the top. Now, treatment lines show the different areas of treatment that sits under the skin umbrella. So the first page that we've been using all the way through this presentation is the assessment and pressure damage prevention. But we've also got a pressure damage and wound management page. And within this, this is where you'll see the information around the pressure damage that you've documented. And again, if you document the full amount of the evaluation, you'd see it all in here. But you can see also they've got the wound title at the top. And if you've got different areas of pressure damage, they'll be shown in groups. And then this page shows exactly the same as it did in the other treatment line with the request prescribed, care team, documents, etc. But this is just to document any wounds, skin damage, things like leg ulcers, incisions, for example, anything that's a wound to a skin. And to go back to the previous page, you click on the arrow next to the treatment line and go back to the purpose T assessment and pressure ulcer prevention. So that is the purpose T completed for now. You've done your skin check and you've also documented what your area of pressure damage looks like. If you want to have a look on a multi-patient task list for a handover, for example, or if you're the nurse in charge of the patient, you can go to the patient focus board, and within the patient focus board safety, as you can see here, we've got an area that says pressure risk, and if you click in the top box, you can actually put the patient to be the most risk at the top or the most risk at the bottom. Okay, so at the most risk at the top, so our patients with no assessment whatsoever will be at the top as being most at risk because we don't know what we don't know. We've not checked this patient's skin yet. Then it will go down to patients on the red pathways, and then patients on amber, and then green. If you want to look at more information about what this patient had done over a number of weeks, you can click within the box and you can see when the last care pathway was completed, the purpose T was completed, and a history of the purpose T completion within this patient's record.